Blog Talk Radio.
Welcome. This is Andy Marino with the Food Pathogen Outbreak Recall Response Group from LinkedIn. And today we are waiting for Dr. David Acheson to come on the line, and he's going to chat with us about the Food Safety Modernization Act. And I believe he's on the line right now. Dr. Acheson? Dr. Acheson, are you available?
Yes, I am. I'm here, and it's good to be with you.
Very good. As I've already introduced you to the group, the Food Safety Outbreak and Response Group, if you have a brief minute, Dr. Acheson, I was wondering if you could outline your background for the group and particularly your experience at the FDA.
No, I'd be happy to. Well, currently I'm a consultant in the food sector, working for a consulting firm called Leavitt Partners, based in Salt Lake City, but I operate out of Washington, D.C. Been doing that about 2 years. Prior to that, I was at the Food and Drug Administration, initially as the Chief Medical Officer in the food part of the agency, Center for Food Safety and Applied Nutrition. And then the last 3 years as the Assistant and then Associate Commissioner for Foods in the agency, which was giving me an overall responsibility for providing insights and expertise to the Commissioner at FDA around all food-related issues, including Food Safety Modernization Act, which it wasn't then, but as we were sort of moving in that general direction. And prior to that, started out my career as a physician. I spent 10 years doing internal medicine and infectious diseases in the UK, where I grew up, and then about 12 years at Tufts University in Boston. I'm working on the basic molecular mechanisms of foodborne pathogens. So one way or another, treating it, understanding it, or regulating it, I've been in the food safety world for about 30 years.
Outstanding. You know, today's discussion is focusing on how food producers have relatively been unpoliced for the last few years, probably since the inception of our country. And now the FDA is taking an active role as a result of the enactment of the Food Safety Modernization Act. How is your response as the former leader of this group in its cultural perspective toward food producers in general?
You know, I think that what we're seeing, and this was a trend that really began 5 years ago, maybe slightly longer. And if you want to try to draw a line in the sand where some of this thinking shifted, it was probably the spinach outbreak in 2006, linked to E. coli, when I think that was a trigger point when the FDA finally said we need to develop preventive strategies that work and not just reactive strategies. And what we've seen here is the culmination of that approach going right through to the signing of the Food Safety Modernization Act in January this year and then beyond. And more and more so, the FDA has been taking more robust enforcement actions. There's been more recalls. There's been more warning letters. And I think that the FDA has moved from a traditional approach of let's look at all the companies that we regulate. And domestically, that's about 150,000 manufacturers, processors, distributors, and warehouses. These are the companies that have to register with FDA. It doesn't include farms, it doesn't include food service, and it doesn't include retail. That puts the number way higher. But those have been the focus of the agency. And typically, the FDA has looked at a food commodity and said, this is a high-risk food. We're going to inspect those companies annually. Lower-risk foods less often, and very low-risk foods hardly ever, if ever. And the shift has been, no. Okay, we now need to look at multiple things that raise risk. The food's part of it. But what's the history of this facility? Have they had problems? Have we been in there once before and seen that they barely have their systems under control? And to give you an example of what I'm talking about here, Andy, is that the infant formula industry has classically been one that the FDA regulates very heavily. Why? Because it's, for the most part, sole source nutrition for a very vulnerable population, i.e. babies. So the FDA goes in there every year, and for the vast majority of visits, everything's looking perfect. They don't need to be there, really. It's running extremely well. There's no problems. Occasionally there are, but for the most part, there's a very strong track record. So what we're going to see from FDA is as they have to build risk-based inspection strategies focused on prevention, they are going to be using a different metric to figure out who to go and visit. And when they go, their visit is going to look different. They are going to be, once we start to see the regulations kick in from the Food Safety Modernization Act, particularly around preventive controls and food safety plans, we are going to see an FDA going in there not with a show us the plan that you're working on. We want to see the binder. We want to see this all written out. Yeah, they may well ask for that, but what they'll really want to know is, are you implementing that plan? Show us that you've got the systems in place. Show us that when you have a problem, you know how to do a corrective action and a root cause analysis, and that you've got it documented. That's how the regulators are going to be approaching this, and not just with the classic HACCP type thinking of looking at your process, but I think we're going to see more and more focus on what is often called good manufacturing practices or prerequisite programs, the sanitation, the infrastructure, the hygiene, the product tracking, your capacity to recall, how you react to customer and consumer complaints. The agency is going to be looking at a lot of those things as well, and they're doing more and more of that, and it's just ramping up over time, and it will continue to accelerate.
Dr. Acheson, you bring up an excellent point, and that's the operations of the food producers, and that'll be examined when the inspectors come in. We had discussed earlier that the ratio, you're saying about 150,000 companies. How many inspectors are there?
Not very many. The FDA has, the inspectorate within FDA is in the Office of Regulatory Affairs, as distinct from the centers where much of the policy and the science is driven. So the Office of Regulatory Affairs has a total staff of about, it's probably running at the order of about 3,000 individuals. Many of those are in Washington, managing the inspectorate. The inspectorate is out in the field, the rest of them. They are broken up into a number of districts, 20 different districts and several different regions. And overall, there's probably of the order of about 1,700 to 2,000 FDA inspectors total. And that includes food and medical products. So it's really not very many to go around.
You know, that's interesting how you mentioned that. What I was focusing in this discussion, I was hoping to focus on, was how, in the event of an outbreak and a recall, what's the FDA inspector's motivation for coming into a food producer's production facility?
That's a really good question, and I think that the motivation is going to be driven by some of the factors that lead up to the visit. So maybe we should just dissect for a minute what might cause that inspector to decide he's going to go and visit a specific processor. And an outbreak starts, obviously, with somebody consuming or being exposed to a food that's made them sick, and they've gone and seen a physician, and the physician's made a diagnosis, and they have connected an illness with a patient, and the local and the state health departments will go through the process of interviewing sick patients and asking them what they ate and where they ate it in the weeks before they became sick, usually a week or so. They'll use that information to begin to develop a short list of foods that are potentially implicated as the cause of this outbreak. This is an epidemiological process. There typically isn't any food testing going on at this point because the food often has not been identified. But that process has over the years been pretty robust in terms of identifying foods that have subsequently turned out to be problematic. As this process is evolving through the states and the Centers for Disease Control, the FDA and